A vaccine expert says there is a need to recalibrate booster shots for healthcare workers and the elderly who got the Sinovac dose after a recent study showed its efficacy against the Delta variant wanes after 6 months. The Food and Drug Administration earlier said it was monitoring the first batch of vaccinees in March to see if the efficacy of the dose has lessened and if they need a booster shot. We now go above and beyond the headlines with FDA Director General Eric Domingo. Good evening, Director General Domingo, and welcome to Newsnight. Can we begin with this, sir? You said you are monitoring yung mga nakakuha ng Sinovac shot back in March, yung mga sa HCWs, healthcare workers, and the elderly. Do you already have some findings at this time or wala pa po?
Ongoing. Paano kasi the first ones, if you remember, Pia, that were injected with Sinovac, tabi na sa PGH. So our doctors in PGH are actually monitoring the antibody levels of people who were inoculated at that time. So ngayon, tinitingnan pa kung mag-wane at kung bababa nga, if there's going to be any effect on the protection. No? So we're still waiting for results on that, and we just completed the 6 months after the second dose. So we're waiting to get more information.
Oh, well, yeah. So we're waiting, but when can we expect that info, that data to be available? Because it is September 1 tomorrow. From March, if you count from March, 6 months is already September.
Yeah, I would think we would get data on that maybe in the next month or couple of months. Ang ano rin kasi, Picky, we have to remember we're not really at a position to give booster shots yet. No, so I think right now the government is still, of course, prioritizing vaccinating more people, as many people as possible before giving booster shots. So we're really just, weighing everything before we even consider giving booster shots in the country.
Well, DG, it's very good that you brought that up because that is a very cause for huge concern, the issue of supply. Kulang na nga, wala pa po tayo doon sa tinatawag na at the very least population protection or at the very most herd immunity. So ang daming doktor na nagsasabi in the last few weeks, no, na medyo may ethical issues kapag merong magpapa-booster shot ngayon kasi nga kulang ang supply. But at the same time, if you look at the other side, when people hear news like this, those who got Sinovac among the healthcare workers and lalo na sa mga elderly, mga pamilya nila, those who got the Sinovac back in March or April, baka nag-aalala na sila ngayon, doctor. So how do you, as you wage those fears, how do you address their concerns?
Well, so far naman, there's not enough data to show that we actually boosters. No, even the WHO is not advocating boosters because we know that even if the antibody levels go down, it doesn't mean that you're not protected. So yun lang, gusto natin paalala sa lahat. Once you're vaccinated, you get 2 doses, you do get an amount of protection that's way above, not getting any vaccine at all. So wag po kayong matakot. Kaya lang talagang kailangan yung equity. Marami pang senior citizen na hindi nababakunahan, marami pang mga people with comorbidities who have no protection or vaccination at all. And we have to really vaccinate as many people as we can to get to that level of protection of the population and herd immunity. So alam natin, yung supplies ay problema natin, but we have to make these decisions. And right now, the decision of government is really to distribute vaccines to as many people as possible before giving extra shots to anybody else.
Oo. Pero may announcement naman po, DG, na may mga parating at may dumating na napakaraming supply ngayon ng mga vaccines. Today, for example, 3 million Sinovac vaccines. In the last few days, the last few weeks, ang dami ring dumarating. So, do you see a situation where makakahabol tayo doon sa issue ng supply na kahit papaano more people will get vaccinated in the next, dapat within this week and the next 2 weeks?
Yes, no, I think our experts are foreseeing that in the next few months, we're going to get a level of protection that's, level of population protection that's high enough, and maybe the infections rate will go down, na makaka-relax tayo, and then we can start thinking of redistributing some of the extra vaccines for those who are most at risk, no? Yun nga ang health workers natin na frontline talaga, yung mga senior citizens na maraming comorbidities, aabot din tayo doon eh. Pero, but not that soon, Pia, no? I mean, that would probably happen towards the end of the year pa. Or yung boosters siguro, if we're going to give them, probably in 2020.
So, DG, siguro ang magiging advice, what would be your advice? Like you said, to relax and not to worry too much. Doon sa mga nakakuha ng Sinovac noong March, I mean, and you, for example, sir, were one of them. Would you say that dapat ipagpatuloy lang yung ating vigilance?
Yes, exactly. No, there's no vaccine naman that has 100% efficacy. We know that we've been getting some cases of what we call breakthrough infections, COVID-19 in people who have complete vaccinations. Fortunately, usually mild, no? At saka asymptomatic yung mga cases na to because the protection that's there. But just because you're vaccinated doesn't mean you have to let your guard down. Kailangan pa rin po talaga natin continuous vigilance, lalo na kayo na mataas ang transmission rate. Pag-maskare pa rin lagi po rin tayong mag-social distancing and basic hygiene. The minimum public health standards are still going to protect us.
All right. Director General Eric Domingo of the Food and Drug Administration, sir, thank you very much for joining us this evening.